Problem. Hello, welcome to the vidcast for Duty to Warn. I'm your host, Don Gartner, and today we are very fortunate to be meeting with Dr. Claire Pouncey, who is a psychiatrist and a philosopher. She's a fellow in the Philadelphia College of Physicians, and she recently co-authored an article in the Journal of the American Academy of Psychiatry and Law called The Ethics of APA's Goldwater Rule. And she's also been very active within the APA, arguing for a modification or the discarding of Goldwater. So I have a lot of very specific questions, but I wanted to just open the floor for you first to say, what is wrong with the Goldwater Rule, and why?
There are a number of things wrong with the Goldwater Rule. One is that it does not treat members of the American Psychiatric Association, which I will henceforth refer to as the little APA because I know that's the convention used by the big APA. It doesn't treat members as full moral agents, as real professional peers who are capable of doing our own moral grappling with the problems that face us in our day-to-day lives and practices. And when you gets right down to it, that's my biggest problem, is that it seems to sort of try to enforce a police power of the professional organization over its members.
Kind of a gag order.
Yeah, well, it doesn't always function as a gag order because unless there's a specific ethics complaint, it doesn't get enforced. There has to be a complaint to the APA district branch for the Goldwater Rule to be enforced or even be considered. Otherwise, people are free to do what they will. But the whole point of having a professional organization and having a professional code of ethics is for anyone within that organization to express shared values and shared mores for how the profession should be conducted within and without the clinic in this medical case, and to have a shared standard of how we proceed in our lives and in our practices that doesn't depend upon enforcement in any way. And the problem with the Goldwater Rule is that it seems to contain a threat that we're not going to be welcomed as psychiatrists in the professional organization if we violate the rule. And that's not the message that a professional organization should be sending. It should provide guidelines that should educate us as to what the standards are without trying to punish us for violating those standards. There are always going to be people who don't abide by the rules in the way everyone wants them to, or people who don't share all the values of that group. And that's just the nature of morals as they are in the world. And the APA doesn't seem to want to accept that.
So just to be more specific, you have a sort of basically a two-part argument that you present in your article. One is that the Goldwater standard that we need to interview the patient personally doesn't actually fit the standards that we use on a day-to-day basis, the standards we use for making a diagnosis, that we use a lot of things. You were saying we use patient history, we use we use observers, people who know the patient well, who can be reporters. We use psychological tests. There are psychobiographers. But maybe you could say something about that there's something that, first of all, just diagnostically and intellectually doesn't make sense about the rule.
Well, it's true. For one thing, the Goldwater Rule was put into place before DSM-3. DSM-3 changed the way we do psychiatric diagnosis from a really psychodynamic formulation to much more observable behaviors. Not solely observable behaviors, but largely interpersonally appreciable public behaviors that we all can commonly agree on how to describe.
Yes.
And so that's a really big difference. So when you think back to what was in Fact magazine, there were all these very psychoanalytic terms and speculations about the inner workings of Goldwater's mind and soul and what his inner conflicts were. And it all comes across as very speculative because no one observing him from afar could possibly know what his inner conflicts are. Right. But with the advent of DSM-3, the basis of psychiatric diagnosis becomes much more observable from a distance so that public behaviors become fair game. And we use all kinds of things to make psychiatric diagnoses. There are still psychoanalysts in psychiatry who use the psychodynamic formulation, but for most day-to-day psychiatric work, we have to use DSM uh, diagnostic standards for the administrative parts of care in hospitals and clinics. Anyone who does insurance-based work has to use DSM standards, and those are all very intersubjectively appreciable. But the larger part of it is that we don't actually we use all different kinds of material to do diagnosis. So it's not just public behaviors. It's not just psychodynamic formulations based on what a patient personally tells us. But we also make all kinds of speculations about what a patient's not telling us. We gather history from family members. We try to collect history from charts that might exist from past care providers. And we collect as much as we can. And then, even with the personal interview that we might get, we don't always believe everything because there are the patient's own conflicts that work as filters to keep the patient from being aware of their own real inner life. And part of the work of the therapist in psychology or psychiatry or other mental health professions is to try to get to the bottom of that and help the patient be realistic and be honest with herself about what's going on in her inner world. So there are all kinds of information that come into it, and it's much more complicated than saying, yes, it is based on a personal interview or not.
I agree with your argument completely, and I've been actually making that argument a lot. And without commenting specifically on Donald Trump, but just to say more in the abstract sense, if I suspected that a public figure, for example, had antisocial personality disorder, and one of those criteria was lying, wouldn't I be able to establish that they were a liar if they had made public untrue statements that had been documented to be untrue by dozens of journalists, and there were dozens of such statements? Wouldn't that meet the criteria? And would I, in fact, know more, appreciably more, if I talked to the liar in chief and asked him, "Are you a liar? Are you lying to me?" And he said, "No, I'm not. You're an idiot. You're a hater and a loser, and very dishonest." How would I learn anything actually additional that I needed to learn to know whether he was a liar, or even additional information that would be useful? Two different questions.
I doubt your professional training would contribute very much to the exchange.
Right. I'm not going to get to the bottom of this, I'm not right. I'm not going to peer deep inside of his soul and get him to reveal himself to me in a way that shows me the inner Donald Trump. Very unlikely, wouldn't you say?
Probably not.
Right. So in terms of whether the diagnostic portion, it's really, and this was Bob Spitzer's dream when he developed the DSM, that it should be things that are observable, including public statements, public behavior, observations of people who know them well, not just internal, subjective, and theoretical constructs. So the other part of your article was really arguing about, in a way, how the Goldwater ethical principle could be unethical. Maybe you could say more about that. You have a number of different parts to that argument.
Well, this comes back to whether the Goldwater Rule itself functions as a gag order. So, there are times when each of us functions strictly as a professional. If I'm sitting in my office alone with a patient or a client or a service user, depending whose language you use, and I'm just trying to sort through what's going on in the moment, I may be wearing the hat of just a psychiatrist. But as soon as I'm a member of the community and I'm maybe a parent or a member of a school board, or I'm a member of a church group, or part of another social group with shared values, the lines become blurred. And, to be an integrated person, I would hope that a lot of those values and shared commitments overlap among these different roles. But in Section 7 of the Little APA's Code of Ethics, I forgot which one I was talking about for a second, the Little APA's Code of Ethics, the clause right before the Goldwater Rule says that psychiatrists have to be mindful. I'm using scare quotes if you can't see me, because I don't think that means very much. But we're supposed to be mindful of when we're speaking as a psychiatrist and when we're speaking as a personal. In a personal role, but our roles always overlap. We can't disassemble to say, well, now I'm just being a Muslim, which I'm clearly not. I'm just speaking theoretically. When we're being a member of a religious organization, or when we're being a member of a local community, or when we're speaking as part of a professional role, it's just not even possible unless there is some kind of research going on that I'm not familiar with.
We can't forget what we know.
Right. So we're always living these multiple roles, and part of personal integrity is having those roles overlap. But there are going to be times when I'm not just a psychiatrist, when I'm a concerned community member, and because we don't forget what we know, my training may make me alert to certain public behaviors or words or other actions that make me alarmed in a way that the next person down the street might not be. And if I really feel compelled to speak out, I need to be able to do that and not sit and fumble and wonder, well, maybe I shouldn't say anything because of my profession. That's when I should be able to speak out because of my profession, because I have sensitivities. And the problem with the Goldwater Rule is that if it silences me because I'm afraid of what the professional repercussions might be, it does function as a gag order. And it does cause me to stifle what I know if I'm deliberately silencing myself because of it. And I might miss an opportunity to possibly A, provide a public service, or B, just be wrong, which is also my personal right to do. I may get it wrong. That's fine. I can do that.
Well, I think this issue of our role as citizens that cannot be divorced from our role as professionals, the phrase that we keep hearing is see something, say something. And it appears the APA is telling us, see something, shut the hell up. That in other words, what you've just pointed out is that as a psychiatrist, you may see things in the behavior of a public figure that alert you with your expertise and your training and your experience, alert you to the potential danger of that person that may not be so appreciably obvious to someone who doesn't have that training. So in a sense, you see something that other people may not see. And
maybe.
Yet, potentially, maybe not, but maybe. But if you see something, even something that other people don't see, that could be relevant to the safety of our society, somehow you're not allowed to talk about that. The analogy I use is, if there was a bomb on a plane, what professional principle of ethics could prevent you from warning the people on the plane? And if that bomb's in the White House and its name is Donald Trump, does that really change things in terms of our obligation as citizens?
Well, to be clear, I don't feel like I'm an expert on bombs in the White House, so I have declined to speak specifically about that threat. Members of the press have asked me about it since that article came out last year, and I don't feel like I'm the wisest, smartest, most observant person out there to make that call. So I don't speak about that particular threat because I don't think I'm the best person to make that call. But it does really bother me that other people who do feel particularly expert and qualified to do so may feel shushed. So my objection is to the Goldwater Rule itself, because I'm not let me interrupt myself. The APA assumes that anyone who does feel compelled to speak out publicly against a public figure must be self-serving in some way, as opposed to, conscientious or wrong, as I mentioned. And there are people who are just loud blowhards who love the sound of their own voices, but the court of public opinion picks them out pretty easily. It's very clear when people are self-serving, but that's not universally true, and I don't know why the APA makes that assumption.
Well, you're familiar with the defense of projection. Is it possible that the APA is projecting, that actually they're the ones who are looking out for their self-interest rather than the interest of the public? Is that possible?
You could make a really interesting philosophical argument about whether organizations can project. To be fair, I know from the recent Little APA meeting that was held last month that the APA is really concerned that if enough individual psychiatrists are going around being the self-important blowholes that they're afraid we all want to be and, are barely restraining ourselves from becoming, that when there's a chance for healthcare reform, or if there's some sort of 25th Amendment impeachment committee to evaluate the mental health of the president, that the APA, Little APA, will be excluded from that process. And I can understand that concern, that the organization, the profession, wants to be included in whatever appropriate and public means there might be to go through an assessment process or to be involved in healthcare reform. And I get that. But it's not at all clear to me, and I think this comes out in the article from last year, it's not at all clear to me how the organization thinks that individual members will threaten the reputation of an entire profession. I don't get it. I also don't get how individual members actually owe anything to the profession. I mean, in the sense that we are all working towards many of the same things and do share many of the values we hold as psychiatrists in terms of wanting to promote patient well-being and wanting to have a better healthcare system and provide care and provide a safe community, sure. But it's not clear how people who may differ in part from those overarching goals and values actually are expected to protect the professional organization and why that should be so.
Well, I think about attorneys, that are on MSNBC talking about whether they think the facts of the case rise to the level of obstruction of justice. No one's jumping in and saying, hey, wait a minute, you haven't interviewed this person or he hasn't been your client. In other words, they're expressing a professional opinion based on their knowledge and expertise. And yet when it comes to mental health, only Morning Joe is allowed to say anything about Donald Trump's mental health. Anyone with any actual qualifications to make those statements is not allowed to make those statements. Only unqualified people are allowed to make them.
Yeah, it just doesn't make sense to me. It's very strange. It's really strange. I mean, people can be sued. What we know from the Goldwater case is that if an individual psychiatrist really shoots her mouth off and says something inappropriate or libelous, and the standards are different for public figures than they are for private citizens, but if something really inappropriate were said, there's always the chance of a civil lawsuit. The APA can just step aside and let it play out. There's also the court of public opinion. Like, people can make fools of themselves.
We're all free to do that, aren't we?
The name.
Well, I want to ask you about, so far we've been criticizing the Goldwater Rule, but is there, in your view, in the ethical principles, some affirmative duty to warn the public? Many people have taken the Tarasoff decision. You write about this in your article. You talk about Gerald Post, who testified about Gaddafi's malignant narcissism. Interestingly, parenthetically, the same diagnosis I used for Trump. That's me, not you. But that he testified about that before Congress was seen as a public service because he was trying to alert lawmakers to a potential danger or threat to the citizens of the United States that his psychiatric expertise gave him some window into. So do you agree that there is some extension of the Tarasoff decision in some more broad way to give us some kind of duty to warn the public if we see something that we need to say something?
I disagree with you on that. I learned something from Jerry Post at this meeting that I mentioned, the Little APA meeting last month. I was on a panel with him. He is a fascinating person. He is not only a psychiatrist, but he's done extensive psychological training in profiling, and he spent most of his career working for the CIA. So he has a level of credibility that, little private practice psychiatrists don't. we don't get that routinely as part of our training.
That's true.
So smart as we think we are, he really is head and shoulders above the rest of us when it comes to that. And he has made a really valuable contribution to the country in what he's been able to do. But he said in this presentation something very interesting, which is that he had his own doubts about what it would mean for him to violate the Goldwater Rule. And he actually contacted the APA Ethics Committee a number of times to ask whether his work with the CIA would be in violation of the Goldwater Rule. And he received somewhat equivocal answers. But if you haven't interviewed him already, I recommend that you do.
I've been trying. I've been able to reach him.
Absolutely fascinating.
If you have his personal contact information other than his academic email, give it to me after the interview.
I don't. I don't, but it's really, really interesting. So he's an excellent example, but he is not a representative example. Now I've just lost track of the question. Sorry.
But actually Friedman, I forget his first name, but you cite him as well. Wrote in the New York Times affirming the Goldwater Rule recently. But if you go back and look at his own oeuvre, there's actually an article in the New York Times from 5 years ago where he says that Gaddafi, again, just coincidentally, had malignant narcissism. Mm-hmm. And he argued that it was okay to violate the Goldwater Rule because this was a matter of national security. And so if we just pursue this logic, so if Gaddafi were to win the Republican nomination for president of the United States, then we can't say anything about him. But up until then, we could.
Well, so, in philosophy, we call that self-contradiction.
That's kind of where I was going.
And we call that equivocation. So I'll let you take that up with Dr. Friedman, who I also know, and he's also a very smart man. So I'm not really sure whether he was keeping track of his own arguments that well. But in talking about whether there's a Tarasov-like duty to warn, I would say that the disanalogy is that in a Tarasov-like case, we know exactly who the victim is and who the threat is, or we're close enough to justify violating confidentiality and alerting authorities to the fact that there's a risk of danger. And with the case of a public figure, we don't know exactly what the risk is. We do know who the potential dangerous person might be, but we can't give the specifics that would make it Tarasov-like. So we can say, we have concerns about this person and we think she could be dangerous, but it's hard to give very precise information. So so it's not about breaking privacy. It's not about violating confidentiality, which is what the Tarasov issue is.
Which is a much more core principle of psychiatry's ethics, I think you would agree, than Goldwater.
It's not about privacy. So because public figures don't have privacy in the same way citizens do, it's not a comparison. I mean, we can speculate all we want about public figures, no matter who we are.
Well, in other words, it's not as big an ethical violation. In other words, to violate confidentiality, you really have to have an awfully good reason, right? Because it's so core to. Whereas Goldwater is more ancillary, CYA, don't get us in trouble or sued or make us look foolish, not some core principle of the ethics of our profession. I would argue that, and we're also told that even if we're not sure someone's a threat, right, even if you just suspect they're a threat, we have to err in the direction of warning people. So my argument would be, if we need to do that to warn, if we can violate our core ethical principles on the suspicion that someone might be at risk to protect that one person, if we're talking about not one person but millions of potential victims, wouldn't that in some quantitative way multiply our obligation to warn, especially if we're not violating a core principle of confidentiality?
Yeah, I can go there with you. I just can't compare it to Tarasov. Because it's a different kind of warning.
It's a different kind of warning. I think it's kind of like in the Constitution, there's the strict constructionists and those people who see broader principles that can be applied in other ways. So just as the founding fathers, when they put together, the Constitution, they may not have been thinking about equal rights for some of the groups that we think about equal rights for now, but we take the larger principle of all men are created equal to apply now to groups that they didn't think to apply it to. So I think there is that general tendency. Of course, there are people who don't want us to do that. And the APA is saying, no, we should go with the strict construction, only this one situation, the Tarasov situation, and not generalize or broaden the thinking from there. But those are really two different ways to approach ethical principles. One is to apply them more broadly, and the other is to only look at them in the most narrow way.
Yeah, but I think the issue goes beyond just a duty to warn. I mean, I think the issue is to speak to your heart and to your own core values. And so for you, it's a matter of feeling like if your convictions and your professional training tell you that there's a danger, you need to be able to speak out. For you, that feels like a duty to warn. For me, it doesn't feel so much like a duty to warn, since I am never sure that I know what the future is going to hold or exactly what a person may or may not do. But it may feel more like a duty to let the public or the press know about behaviors that could be expected. So it's less precise than a particular warning, and it may not be a duty so much as a strong conviction that there's something that people need to be alerted to, and I may be in a position to provide that alert. So duty to warn, I think, is a very strong way of phrasing it, and maybe that's because you feel it very strongly. You feel it as a duty to warn, but someone else may not feel it in exactly those terms. I think there are gradations of how to experience.
You're thinking more about freedom of consciousness, freedom of conscience, or freedom of speech,
right.
or freedom to have your behavior dictated by your conscience.
Yeah.
As a human being.
Right.
Okay.
But then, if I can riff off that for just a little bit.
Sure, please do.
On to something else. The APA actually broadened the Goldwater Rule rather than narrowed it back in March.
That's right.
You know about this, right?
Yes.
So, part of what...
explain how they did that, yeah.
Yeah, the article last year... in the article last year, we complained that there's this ambiguity in the language that psychiatrists are not supposed to express professional opinions. And we're like, well, what's a professional opinion? If it's a diagnosis, like you and I were talking about just a few minutes ago, does that mean any psychodynamic formulation, any public behavior that could be used in a DSM type diagnosis? And and the ethics committee actually broadened it in March, just a couple of months ago, to say that it can include any professional observation, practically, like almost anything that would go into a mental status exam. They didn't use those words exactly, but they almost made it as broad as like what color shirt a person's wearing, or whether they're fidgety when they talk to you or talk to the press, or
so dangerousness. Like some people have made the point, I'm not going to give them a diagnosis, but I specialize in dangerous behaviors, and people who exhibit A, B, and C behaviors are often dangerous in X, Y, and Z ways. So without saying this person has this diagnosis, I'm simply saying that educating the public when we see these warning signs, they suggest risk of X, Y, and Z, that even that now would be impermissible.
Right, which, means no one can talk to anyone about anything. It makes it so...
Except what medication to take and how much they should pay us.
But what the APA does seem to recognize, because they're saying we can't talk about any observations of public figures, and they're saying that any of those observations can be included under the umbrella of a professional opinion. In the same broadening, they talked about how... sorry, I just lost my train of thought for a second. They talked about how it's coming back. My train of thought is coming back. They talked about how you have to get consent to have a personal interview, and then once you have consent, you can't release any of that information. But they ignore that there are lots of times when patients don't consent to even having the interview, let alone having a full diagnostic interview. And anyone who's ever worked in an emergency setting knows this. Anyone who's ever worked in community psychiatry, when they're crawling through basements in abandoned buildings, know that people do not consent to psychiatric interviews. So that doesn't make any sense. And then And then with respect to releasing information, with respect to not having a personal interview, the APA doesn't seem to really acknowledge that if there isn't one, if there isn't that interview, then it's just not a diagnosis. It's not a professional opinion. Everyone knows that if the doctor isn't in a formal doctor-patient relationship, it's something other than that it's based on professional expertise, or the opinion might be based on professional expertise, but isn't what we're talking about as if the doctor and patient were sitting in the same room working towards the same goals.
I'd like to just read one quote from your article. I thought it was particularly pithy. Goldwater is not only unnecessary, but it distracts from the deeper dictates of ethics and professionalism.
Yeah, I think that's right. I started to get to this when I started talking to you at the top of the hour. What professional ethics are meant to do is solidify what we share as members of a professional community, the values, the commitments, the goals. We're working toward patient well-being, patient health, public programs that support health and provide access to care. And the Goldwater Rule undermines that by pitting psychiatrists against the professional organization that articulates the moral code. So the moral code stands alone. It's abstract. It doesn't have to be articulated in the way the APA does articulate it. It happens that the APA adopts the language of the American Medical Association Principles of Medical Ethics and then adds annotations for specific circumstances that arise commonly for psychiatry. And that's where the written code of ethics comes from. But the shared values are much more inchoate and tacit. They just arise as part of professionalism, professional training, and they don't have to be articulated. But what a profession is, and what makes a guild a profession, is sharing rules explicitly to say that as long as we're part of this profession, we're going to adhere to this. We're going to live and practice according to these values. But the rules themselves aren't meant to be enforced in the sense that getting thrown out of the organization is the downside. It's meant to be like a way to remind us that if you want to be brought back into the fold, or if you want to stay in the fold and have this fiduciary responsibility to patients, this is how we live and practice.
Well, I'm glad you're still in the fold, and I really appreciate the article that you wrote and I know also just as a person, the attention you've given this issue, going to the APA meeting and arguing for this, etc. So we're very grateful to you for that and also for speaking to me today.
Well, thanks, John. Thanks for having me.
All right. Take care.
Bye-bye.
Bye.